Just into the 13 on your side newsroom, the Michigan Catastrophic Claims Association is supporting Governor Whitmer's call for auto insurance refunds. Now, the exact amount of those refunds and when they'll be distributed still to be determined. Meanwhile, another long-term care program is being forced to close its doors as a result of the changes to Michigan's no-fault insurance policy. A statement from Spectrum Health says in part, the funding cuts mean they are no longer able to provide care in their residential rehabilitation program, causing it to close. 13 on your side's Justin Bachman joins us now. And Justin, you have been following these changes since they took effect. What makes this closure different?
Juliet, we've seen dozens of independent clinics and programs shut down around the state since they went into effect July 1st, those no-fault changes. But a major hospital system cutting a program is setting off alarm bells for advocates of the catastrophically injured. The announcement came on the same day that Governor Whitmer called for those auto insurance refunds. Her letter said that the money should come out of a surplus in the MCCA, that Catastrophic Claims Association, the same fund that picks up the bill for no-fault insurance. According to the Michigan Brain Injury Providers Council, at least 45 companies around the state are unable to provide care to patients through auto insurance because of those July 1 changes. They say that in just the clinics they work with, more than 1,500 healthcare jobs have been lost, and at least 18,000 patients rely on the MCCA to cover the cost of care, and calling for refunds now is inappropriate.
It's just a disappointing time to request that when we are seeing people lose their care. We're seeing insurance companies not pay for basic rehabilitative needs and long-term care. And that needs to be addressed before we start talking about raiding the Michigan Catastrophic Claims Association.
I reached out to both the governor and the Department of Insurance and Financial Services. Neither office was able to get someone around for an interview, but a representative with DIFS says that the governor's call for a refund will not take money used to care for victims of accidents. Governor Whitmer's office also did write back saying that she has been an advocate for the catastrophically injured, and they provided us with 2 letters as examples, but both of those letters were dated before July 1 when those changes took effect.